Hey everyone, my name's Bergeron. I'm an exercise physiologist, and today we're going to do a little bit different of a class. Today we're really going to focus on your lower back, keeping it happy, functional, and increasing the flexibility in that lower back. A lot of times having very tight leg muscles, lower back, core, messes with that lower back, causes pain, discomfort. So today that's really what we're going to work on, lower back prevention and injury rehab. Today the only thing you're going to need is a belt. Nice and simple. You can use any type of belt, but make sure it's decently long like this one. Now, if anything in this class causes you pain or discomfort, please do not do it. Everybody's a little bit different, especially when we're talking about lower back and lower back injuries. One person might respond awesome to one exercise while another person does not. So keep that in mind. If there's any funkiness throughout the class, just sit that exercise out, hop back into the next one. This is a very generalized lower back program. So what I'd like you all to do is lie down. So today you're actually going to need a mat, or if you want to use your bed, you can definitely use your bed if you have the TV nearby, and you can do so. But I would not suggest using a couch. We're going to be bringing our legs side to side, so you really need room. So a nice firm surface would be ideal. But if you have to use the bed, you can definitely use that as well. So let's bring you right onto your back. Lying down flat, I'm going to move my arms out to the side because I want you to watch my lower back. What we're going to start off here is a pelvic tilt. So knees are bent, feet are flat. We have this natural lumbar curve right here. What you're going to do is start off by pushing your belly button into the ground. Now, if you watch my lower back, I'm actually flattening my lower back into the ground, and then I release, and it arches. I can stick my hands back under there. Now, breathe out, push your belly button down, breathe in, and release. So we're just going to keep going nice and easy, one right into the next. Now, anybody with a lower back injury should really do these exercises every single day. Pelvic tilt is basically the #1 exercise when it comes to an injured lower back. Let's just go for a few more. And on your next one, I would like you to push down and hold. So just push and really flatten that back right into the ground. We have about 10 seconds. Keep breathing throughout. Do not hold your breath. 5, 4, 3, 2, and release. All right, so now coming out of that, we're gonna go for knee in, kick up. Now, starting in the same position, you can bring arms down by your sides. We're bringing our right knee into chest, and now we're slowly kicking upwards until we get a stretch in the hamstring or calf. Bend it in, drop it down. So I'm breathing in as I draw my knee in, breathing out as I kick it up, bend it in, drop it down. So your goal here is just to get a nice, easy stretch behind that leg. Now, when it comes to stretching, you never want to force it. You just want to go nice and fluidly. One right into the next. Breathing out as you come up and kick. Breathing in as you bring it down. We're going to go through a full set of 10, so we have about 4 on each side done. Let's keep going with that. Each time, seeing if you can straighten that knee a little bit more. We have 3 more, starting now. And last one on each, starting with this right leg. Okay, and very nice. So now what I'd like you to do is we're going back to a pelvic tilt motion. So let's practice just 2 more times. Take that belly button and push it down, flattening your lower back, and then release. 1 more time, push it down, and release. Now, I want to show you the power of a pelvic tilt and what it does to your abs, what it does to your core. So now I'm going to put my arms out so you can always see my pelvic tilt motion. For these first couple, I do not want you to even worry about the pelvic tilt. I want to show you the difference. So take both knees and bring them in with your muscles only, and then slowly drop them back. Let your heels touch before your feet. Now bring them in, drop them down. Now I just want you to analyze how this feels in the stomach. So you're not worrying about any pelvic tilting, you're just drawing your knees in, bringing them down. Let's do just one more. Okay, so now you kind of got the feeling how that feels. Now what I'd like you to do is take that belly button and push it down into the ground. Keep breathing, don't hold your breath. Now holding that lower back flat into the ground, bring both knees in, lower them nice and slow until the heels touch, trying to keep that lower back flat on the ground. Now when they touch, you can release your pelvic tilt, re-tilt, bring those knees in, drop them down. You're gonna notice you get a lot better ab contraction right around that belly button or a little bit lower while you do this pelvic tilt. So now that you got a little used to it, try to never let your tilt go. So as you drop your heels on the ground, don't release your tilt, just bring those knees back in. You can breathe out as those knees go in, breathe in as those heels drop back down. We're going for 5 more. Activating the core in these lower abs is very important to keep the lower back safe and strong. We have 2 left. And very nice. So you can release off of that, release your pelvic tilt. So you should have got a nice ab contraction during that. Now from there, we're going opposite knee push, so we're gonna get these abs kicking even more. We've done this in previous classes in the chair, but doing it lying on your back is the best way possible. So we still have knees bent, feet flat. I want you to bring your left knee in towards your chest. Right hand pushes on the front of that left knee. Your goal is to push in and down so hard that you feel it in your stomach or the sides of your body. Now drop that leg down. Alternate sides. Push as hard as you can, breathing out, drop it down. So for each one, we're gonna hold it for 1 or 2 seconds, and then we're bringing it down. And we're just gonna go nice and fluidly. 1 right into the next. Really trying to breathe out each time you push down on that knee and put as much pressure into the hand with the knee as you can, and as much pressure hand into knee as you can. And just keep going nice and fluidly. We are halfway through. We have 2 more in each, starting now. All right, and good. So after that, we're gonna loosen up the torso a little bit. Now, if you know you should not be rotating from the hips because you have some sort of injury, please just sit this one out. If you feel any pains, please sit this one out. So this is all about staying safe. It should be good for most people, but I always like throwing that out there just in case. Now, your feet are flat, your knees are bent, your knees and feet and thighs are all touching. Now what I'm gonna do is take my knees and rotate them slowly to the right until I start to feel a little stretch. Now I could get a stretch in my left leg, hip, torso, shoulder, even going down the arm. Now, once you get a little stretch, come on off, bring those feet flat again, and then rotate the knees all the way to the opposite side until you get a little stretch, now going down this right side. Now let's rotate back. Now, as your legs are falling down and rotating, breathe out. Breathe in past the midpoint, and then breathe out as you get to the other side. So arms are out like a T, palms are down, and as you rotate those feet to one side, make sure you stack your feet. So as I'm rotating my knees to the right, my left foot is right on top of my right foot, so only the outside of my right foot is touching. Now as I rotate to the left, my right leg is on top of that left one. So now only the outside of my left foot is touching. And let's just keep going nice and fluidly, breathing out at each side point, trying to just get a little bit more stretch with each rotation. Taking it nice and slow, just as we always do. You never want to force any of your stretching. We're going to do a few more reps on each side, and then we're just going to hold our stretches to really loosen up that torso. Now, when you get back to the right, what I'd like you to do is just let those legs hang. So you're rotating to the right, and then just let the weight of your legs carry you down. Get a nice stretch anywhere from outer leg going all the way up into left shoulder or arm. Breathe nice and deeply in through your nose, out through your mouth. Try to work with your breathing. You may notice that every time you release a breath, those knees want to go down even more. And that's exactly what we're looking for. Just make sure you don't rotate the knees so much that your arm is picking up. You want to keep those shoulders right on the ground the entire time. Now we're going to slowly transition all the way to the left. And then same thing. Just let those legs drop you down, feeling a nice stretch somewhere from outer right leg all the way up the side. It could even go into the shoulder and the arm, making sure that right shoulder does not pop up off the ground. And just keep breathing nice and deeply in through your nose, out through your mouth. Four, three, two, and slowly switch back. We're going one more time on each side. So bring those knees all the way to the right and just let them hold, breathe nice and deeply. We're going to be here for about 20 seconds. Hopefully you're able to go a little bit further this time. 5, 4, 3, 2, and slowly come back. Rotate those knees all the way to the left and hold once again. Breathe nice and deeply in through your nose, out through your mouth, using that breathing to your advantage to try to drop those knees down a little more, but never going too much too soon. So just take it nice and easy. We have 10 seconds left. 3, 2, slowly rotate back to the middle. So now once you get there, you can bring those arms by your sides. They don't have to be out like a T anymore. Widen your stance of your feet. So you have about 3 to 4 inches in between your knees and your feet. So now we're going to go for bridges. Really good exercise for the entire core. So now from here, what I'd like you to do is take your hips and push them up to the sky as much as you can, squeezing the butt. Release, drop it down. So start off with your feet flat, and then we're going to change it in a little bit. Breathing out, bring those hips up, squeeze the butt. Breathe in, drop it on down. And let's just keep going nice and fluidly, one right into the next. Now, if you feel cramping in your hamstrings during this, a lot of times if you have tight hamstrings, they will cramp up in this motion. Then just take a second and do like we did in the beginning. Just stretch it out for a couple seconds and then hold it, then come back into the exercise. So bring them on up. and down. Now that you got used to it, pick up your toes so you're only on your heels. This teaches you to drive through your heels, which is what you should be doing with a lot of different activities throughout your daily life. So now, keeping your toes up, bridge up, squeezing the butt, release, bring it back down. Breathe out, and breathe in. So we're gonna go for 5 more like this. Your final 2 are coming up. All right, and very nice. So now let's bring those legs out straight. Now from here, what we're gonna do is just knee to chest pulls. So arms by your sides to start, legs out straight, toes up, try not to have toes just being lazy and flipped out to the outskirts. Keep them right up. Now bring your left knee into chest, grab it with your hands, pull that in as far as you can. You should be getting a stretch in the hamstring, butt, maybe even the lower back. Drop that down, alternate sides. So you can breathe outwards as you bring that knee in, breathe in as you bring it back down. And we're just going nice and slowly, one right into the neck. So if you're really feeling a nice pull in the butt or the lower back, chances are you definitely have a lot of tightness there. Could be due to a little sciatica, could be due to maybe herniated disc or anything like that as well. Now, while we're doing these nice easy knee pulls and you can listen, you don't have to worry about doing anything crazy, I want to tell you about the glutes and the lower back. So now the reason why I have people do bridges for lower back activities is it is actually proven that inactive glute muscles, so inactive butt muscles, but they may cause a lower back injury. I've actually worked with personal training clients before that could not fire up their glutes, and because of this, they would have back pain. So once we worked on really firing up those glutes, getting them activated like they should be, the back pain went away. So that's why it's always a good idea to squeeze the butt anytime you sit and stand or do any type of balancing motion. Now, when you get back to your left leg, what I'd like you to do is just bring that knee in, pull it in until you get that nice stretch in your hamstring, butt, or lower back, and just hold. We're gonna be here for about 20 seconds. So just breathe nice and fluidly and deeply in through your nose, out through your mouth. Make sure that right leg isn't tilted off to the side. Keep it nice and straight. Now, if you're really tight in the quads, which is the front of your thigh, you may even be getting a little stretch right in the front of that right thigh right now. And that's okay. You get a little double stretch for this one. 4, 3, 2, and very nice. Bring that down. And now let's swap sides. So bring that right knee in as much as you can. Pull that right knee into chest, looking for a stretch in your hamstrings, butt, or lower back. And we'll just hold it there. Nice deep breaths in through your nose, out through your mouth. Be here for 12 more seconds. 3, 2, and slowly bring that down. Now from there, let's bend those knees back in. What I like to add into all my lower back programs is loosening up the inner thighs. I think it's very, very important. So let's go for about 3 inches in between your knees and your feet. Knees are bent, feet are flat. Now what I want you to do from here, I'm just gonna throw my arms out to the side so you can see my spine and my legs. What we're doing from here is rotating outwards. So knees go out. You're gonna feel a stretch in the inner thigh or groin, and then bring it back in. Breathe out, open up, get a nice little stretch, and then breathe in. And we're just gonna keep going nice and fluidly, one right into the next. We're gonna start off like this, and then after a few more, I'm gonna add in another couple pieces to this motion. All right, so now after this one, when you bring those knees back in, what I'd like you to do is pelvic tilt. So pelvic tilt, flatten your lower back into the ground, release, let your knees come out. As they come out, I want you to arch your lower back. So we're gonna work a little range of motion in your spine. So you should have a good arch in that lower back now. Then breathe out, knees in, pelvic tilt. Breathe in and go for it. Just right, nice and easy. So we are switching our breathing pattern on this one compared to what we were just doing. So as you go out, you're breathing in. And as you pelvic tilt, you're breathing out. So just slightly different than how we started. Make sure to get a nice little back arch in there. We're going for 2 more like this. And then now on this one, switch your breathing one last time. So just rotate those knees out. Don't worry about arching the back. It's probably gonna do it. I just want you to hold like this. So let the weight of your knees drag you down to get a nice mild discomfort stretch in the inner thigh or groin. If it's a little bit too much for you, take your hands and support your thighs. That way the legs don't drag you down too much and force any stretching. Always just want to go to mild discomfort or a little past. We're going to hold this one for just another 5 seconds and we're going to go in for round 2. And good. So let's bring those knees back in. Let's go one more time. Rotate out. Let the weight of your legs drag you down. If it's a comfortable stretch or slightly discomfortable, stay there. If it's too much, hold your thighs. And just breathe fluidly. We have 20 seconds. With each breath, try to see if you can get those legs to relax and fall out to the sides a little more. Four, 3, 2, and very nice. So let's bring those knees in. You can straighten those legs down. Now I just want to teach you a proper sit-up. This is going to help you for any time you need to get out of the bed, if you're lying on a couch. If you have a lower back injury, curling forward like a regular sit-up like this is not the best for you. You're actually rounding that lower back, which if you have a herniated disc, that could cause some good problems or just make it not as comfortable as it should be. And then especially if you're going back down on your couch or bed like that. What I like to say is imagine you're a mummy rising out of the grave. Instead of your head leading, you want your chest to lead. So chest up tall, and I have a nice flat back that way. Even when I go down. When you go down, you are gonna round a little bit towards the end, and that's okay. I would rather you use your elbows. So we'll practice even a different one. If you want to put your elbows into the ground like this, chest up, use your elbows to help you up and then onto your hands. All right, everyone. So now that we've done all those motions, what I want to do is do some stretching. Very important for the legs and the lower back. So I would like you to grab your belts. Now, if you don't have a belt that's at least, let's say from foot to hip, then you could grab a towel. If you have a nice long towel, you could hold both sides of that towel as well. If you have a yoga strap or a stretching strap, that's even better. So now what I like to do is take my strap, put it right through. So I put my strap right through the loop of the belt. Now put that right on the ball of your foot or the arch of your foot. Now you definitely don't want it forwards into the toes because I don't want it to slip back and come off and hit you. So now from here, chest up, and you'll see the importance of why you need at least a foot to hip belt. So let's lean back into it. Now I put my belt right around that left leg. What I'm going to do from here is using both arms, I'm going to pull that leg up as high as I can until I get a nice mild discomfort stretch in my hamstrings or my calf. You may get a little bit behind that knee, but If you get it in the butt or the lower back, that means you really, really need these stretches. So hold right here at mild discomfort. If you get comfortable and you just want to use one hand, go for it. Now, if you look at my knee, it's not locked out like this. I do have a little bend in my knee at all times. You want to protect that knee joint. So from here, we're just going to hold that belt wherever feels comfortable. Make sure the toes are not tilted left or right. You want those toes nice and straight. We have about 10 more seconds right here. 5, 4, 3, 2. Now slowly bring that leg down. I like to reset the leg fully. So bring it all the way down. And then now let's bring it back up. This time I want you to keep a good bend in that knee. So you can mess around with it. The angle of your knee is just going to determine how it stretches. So keeping a good bend in that knee, pull it in as much as you can. This one should really affect the hamstrings, butt, or lower back. You may get a little bit in that calf, but most likely it will go right into the belly of that hamstring. So let's hold right there, breathe fluidly. Make sure your right leg is not bent up like this. Try to leave that leg flat. This is where you might get a quad stretch in the front of that right thigh as well. So I'm going to be here for 15 seconds. Just relax. Never trying to fight through your stretching. Just nice and easy. 4, 3, 2, and slowly bring that leg down. Now we're going to do one more like this. So reset that leg, bring it up. Now keep a little bend in that knee. Once you get an initial stretch, what I want you to do is take that left leg, move it across your body to your right. You probably will not have to go much, and you'll feel a greater stretch in the outer left leg leading into that left hip. And then just hold right at mild discomfort or slightly past it. This time, this one sometimes even gets right at the top of the calf as well. Breathing nice and fluidly. Five, 4, 3, 2, and slowly bring it to the midline and then drop it down. All right, so after those, we are going to go into our quad stretches. So this one's a little bit tricky to get into position. So what I'm going to do is I'm going to sit up, spin, and face you a little bit differently. So lying on your back, holding that strap with your left hand, what I'd like you to do is roll on your right side. Use your right hand as a pillow and try to move that strap. If you can see now, it's pulling towards the front of my foot. Try to rotate it if you can reach to pull from the back of your foot. That's not the biggest deal, but if you can, definitely do so. Grab that strap, bring it around and over your left shoulder. Now I'm using my left shoulder as an access point to pull my left heel to butt. And I'm getting a nice stretch right in the front of my left thigh. Now, if you're physically not able to get into that position, what you could do instead is just move the knee up, grab your ankle, and then you can pull heel to butt. So either way, with the strap, using your arm, just hang out right there, get a nice mild discomfort stretch. Breathe fluidly and hold. I'm going to be here for about 12 more seconds. 3, 2, and slowly come off. Never let that leg just shoot right out. So from here, sit on up, grab your strap, and let's switch sides. We're going to do that same circuit on the opposite side. So put your strap right at the ball of your foot, a little bit under it, going into the arch of your foot. Lay back. Now we're going to pull that right leg straight up. Now straight doesn't mean locked out knees. You want to try to keep a little bend in that knee at all times. And then just hold. So now you can use one arm, you can use 2 arms, whatever you feel most comfortable. Just get a nice mild discomfort stretch in that hamstring, calf, maybe a little behind the knee. Also could be in the butt or the lower back. And then just breathe fluidly, hold that mild discomfort. We have 15 seconds. Make sure your left leg is flat on the ground, or as flat as you can. You just don't want it bent up like so. Keep that nice and straight. 5, 4, 3, 2, and slowly lower that leg down. And then from there, we're going to take it back up. Keep a nice bend in your knees. And then now pull. You're going to be able to pull that leg in a little bit more. Pull it in until you get a nice stretch in that hamstring. Most likely it's going to stay in the hamstring, butt, or the lower back. You may get a little bit in that calf. And then just breathing nice and deeply in through your nose, out through your mouth. Left leg is pretty straight on the ground. If you're very tight, that left leg may want to really pop up, but just do your best to keep it down. That's where you might get a quad stretch in the front of that left thigh as well. 10 seconds. 3, 2, and let's reset the leg. So bring it all the way down. And then one last time with these hamstring stretches, bring it up. As you get your initial stretch, keeping a little bend in that knee, move it over across body to your left. Now that stretch is going to change to the outside of that right leg. You may even get that upper calf. You may even get it right in that outer hip leading into the lower back. So just hold that at mild discomfort and relax. So this IT band, which is what we're stretching and stretching around, which goes from outer knee to outer hip, it gets very, very tight. So doing these type of stretches really helps it out. And I've seen a lot of these IT bands get so tight, they pull into the hips, which pulls into the lower back and causes a little bit of pain or discomfort. So stretching everything around the lower back really helps that lower back stay nice and happy. We have 5, 4, 3, 2, and bring it back to the middle, and then lower it down. So one more time for the quad stretch. I'm going to hop up. I'm going to flip my side for you so you can see a little better. Now when it comes to this, we were pulling from the front. Try to see if you can loop it around so it pulls from the bottom of your foot instead. Now from there, roll on your side. Using that strap, pull it up and over your right shoulder. Using your left hand or both hands to pull, you should be pulling that heel to butt to get a nice stretch in that outer right thigh. So let's just hold right there. And just like before, if you can't get into this position with the strap, feel free to just bring the knee forward, grab your ankle, and then pull like so. Do your best not to have it way up here as well. Try to keep it nice and level. So you could be holding like so, or you could be holding with the strap. We have about 15 more seconds. Just keep breathing fluidly, left leg out straight. Try not to have it bent in. 5, 4, 3, 2, and slowly come on out. So from there, we're done with the strap. So you can take that strap right on off and bring it right out of the way. Now, our next set of stretches, we are going ankle on knee. So what I'm doing is keeping both knees at the moment, feet flat, knees bent. Now I'm bringing my right ankle on my left knee. I'm looking for a stretch around my right hip joint. Sometimes it goes into the inner thigh, sometimes it goes into the outer hip and wraps into the lower back. All depends on where you're tight. Now, if this is giving you a stretch already and it feels pretty good, stay there. You could give a little outward push if you need just a little more. But if you don't get the best stretch like so, what I'd like you to do is grab your left leg. So you could grab your pant, you could grab your leg itself, pull it in, hold it behind that hamstring. And now you should be able to pull into a certain point where you get a very nice stretch around that right hip region. So hold that stretch at mild discomfort and just hang out. Now, just as a little side note, if you have an object that you can put your left foot against, so if you look at my left foot, I have it flat, so it's nice and vertical. You could put that foot against the wall, against the couch, and that way you're not even holding your leg up. You're literally just hanging out just like this, getting a nice stretch in the right leg. If you don't have anything, just pull it in. Just do your best not to be pulled up and crunching your neck. You want to just relax down. We have 5, 4, 3, 2. Slowly bring that down. And now let's alternate sides. So switching sides, left ankle on right knee. Same thing, if you get a good stretch just doing this, hold it there. You can push out a little bit. Or if you need more, pull that right knee in towards your chest. And hold. So you should be getting some sort of stretch around that left hip region. If you're really tight, it may even go into the lower back. And then once again, as a little side note, if you look at my right foot, how it is nice and vertical. If you put that foot against a wall, a couch, you don't even have to worry about pulling your leg in. It just holds it there for you and you could hang out. But that's only if you have something accessible, nice and close by. If not, just keep pulling, but make sure you're not crunching up with your neck. You don't want to tighten that up. And then let's just hold. We're going to be here for about another 10 seconds. 3, 2, slowly bring that leg down. Now we're going to alternate one more time. So right ankle on left knee. Now from here, I would like you to pull your right knee towards your left armpit. So you're just going to pull that right across, and you should get a very nice stretch in your outer right hip. And then let's just hold right there. Make sure you're not pulling so much that your butt of the right side is coming off. Your hips and your butt should stay nice and flat, and you should only be moving the knee and the leg. We have 15 seconds. Five, 4, 3, 2, and slowly bring that right leg down. Alternate sides, left ankle on right knee, and then pulling left knee across body to right armpit. So pull that across, and you're gonna get a nice stretch in that outer left hip. Sometimes it even leads down that left leg, or it even wraps into the lower back. Breathe fluidly and just relax. Ten seconds. 3, 2, bring that leg back down. Now what I'd like you to do is bring both legs out straight. We're gonna practice that get up, so make sure you're not getting up, especially with a lower back injury, make sure you're not getting up rounded. You should either be, this is another option, you should either be rolling onto your side to get up, or definitely preferred is chest up tall, coming up just like a mummy coming out of its grave. If that's tough for you, just like we practiced before, use your elbows. So stick your elbows into the ground, chest up, come on up, use your hands. Whenever you have a lower back injury, you want to try rounding that lower back as little as possible. So that is it for today. I hope everything felt great. I hope your body feels a lot better. We did a lot of work in loosening, strengthening that core and lower extremities. So I will see you all next time, and have a good one.